Mino, you want to come close? Okay, let's get started. We're covering a lot of ground today. I'm joined today by the Houston Health Department Director Stephen Williams, the city's medical director Dr. Purse, Mino Davis from our Office of Human Trafficking and Domestic Violence Initiative, Chief Pena with the Fire Department, Assistant Chief Wendy Bambridge, and then HPD Lieutenant Julia Pleasant, and others who are gathering with the city on an important initiative. First, I want to provide an update on the City of Houston's COVID-19 numbers. The Houston Health Department reports 367 cases of COVID-19 today, bringing Houston's total to 87,566. There is one newly reported death, bringing the city's total to 1,374. The person who died was an Hispanic male between 40 and 49 with underlying health conditions. Today, Houston's positivity rate is 6.9%. If you can recall last week, this time it was 6.7, so it inched up ever so slightly from last week. That number is still too high, and again, the goal is to return to 5% or less. Our positivity rate is very important, so let me remind people to keep these masks on and to engage in social distance. COVID-19 has changed our reality, and we must continue to change our behavior to meet this new reality. We know what's happening all around us throughout the country, even in places like West Texas, El Paso, and so we need to do our part to make sure that this virus remains in a manageable state. To remind us all of the importance of doing these things every single day, the Houston Health Department today launches phase 2 of its public health campaign, Don't Stop, Don't Forget. We have 2 videos to show, like Better Together, Don't Stop, Don't Forget, includes multilingual advertising across radio, TV, print, social media, website, and billboards. Let me pause for the 2 videos.
Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat, for our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Moving forward on today's other announcement, the COVID-19 pandemic has created significant challenges in our community, and the city has responded with programs and funding provided by the CARES Act to directly benefit our most vulnerable Houstonians. Today, we are intensifying our efforts to address domestic violence, where we are seeing a rising number of cases during the pandemic. The Mental Health Division of the Houston Health Department, Crisis Intervention Response Team, and community partners will enhance their reach to serve more domestic abuse victims and those suffering from mental or emotional illnesses. This public health and law enforcement initiative is intended to better address the emotional and mental stress that is at an all-time high level in our community. People have lost their jobs, they're at home more, people are facing substance abuse or homelessness. The Domestic Violence Response Initiative is needed now more than ever, given that COVID-19 has negatively impacted Houstonians, especially where the victim's partner's work schedule has been strained, resulting in increased financial hardship and stress in intimate partner relationships. Recognizing what we are confronting, we are putting $6.2 million in CARES Act funding to assist victims of domestic violence. We do know that domestic violence offenses have increased to 9.39% in March, 3.79% in April, and 15.51% in May as compared to the same months in 2019. And domestic service calls are more violent than pre-pandemic incidents. Calls related to family violence, such as aggravated assault, have increased by 48%. Victim advocates are more frequently conducting their own scene crisis response and interviewing in hospitals because victims are being immediately transported via ambulance from the scene due to the severity of the domestic incident. Suicides have increased 8% during the same period. Mental health-related calls are projected to exceed 45,000 crisis intervention calls in 2020, an increase of 5,000 over last year. The additional funding would allow for CERT crisis intervention response teams and DART domestic abuse response teams to respond to more calls. A CERT team pairs an HPD officer with a master-level clinician from the Harris Center of Mental Health and Intellectual and Developmental Disabilities, formerly MHMRA. HPD has currently 12 teams. In addition to their knowledge of mental illness and counseling experience, the clinicians have direct access to consumers' medical data and the Harris Center and Harris County Hospital District systems. A DART team pairs an HPD officer and victim advocates with the goal of providing crisis intervention for domestic violence victims within minutes of a 911 call. By reducing response time to domestic violence victims, HPD will be able to more quickly connect abuse victims with community partners who will provide resources such as emergency housing, short and long-term counseling, legal advocacy, access to free health care, including forensic medical exams or case management. I want to introduce you to Houston Health Director Stephen Williams, who will be followed by HPD Assistant Chief Bambridge, who will speak to CERT. Then Lieutenant Pleasant will speak briefly on the DART program. Stephen Williams.
Thank you, Mayor. Good afternoon. I'm Stephen Williams, the Director of the Houston Health Department. Mayor Turner described what resources to address domestic violence why they are so vital, especially during the COVID-19 pandemic. The initiatives discussed today both create new programs, but they also support existing resources to address domestic violence crisis. The Houston Health Department is proud to provide financial support to Houston Area Women's Center Domestic Violence and Sexual Abuse Hotline with CARES funding. The total number of daily domestic violence calls the center receives increased about 38% from May to September of this year. The number of daily callers needing immediate shelter is also up. Historically, the holiday seasons mark an increase in requests for services, which could further strain our system. This is clear and increasing a public health threat and why the Houston Health Department is helping. These CARES dollars will help the Houston Area Women's Center support the needed increase in advocates and equipment for the hotline. People experiencing domestic violence can call 713-528-2121, 713-528-2121 for immediate help and support.
Good afternoon. My name is Wendy Bainbridge, Assistant Chief with the Houston Police Department. HPD often collaborates with other agencies to be more effective and responsive to our communities. A collaborative response model enables our citizens to get the help that they need from outside resources that is often at the core reason for a law enforcement response. By addressing these core issues and connecting the victims to resources, we enable our public to have a more permanent resolution, thereby reducing the need for a future police response. The programs Mayor Turner just described are HPD's program, our CERT program, which we've had since 2008, and our newest arrival, our DART program, and that's the Domestic Abuse Response Team. Our CERT program is housed in our mental health division among several other innovative strategies that we have in responding to those with a mental illness. As the mayor stated, we have 12 such teams, and that's not enough. Each team has a clinician and an HPD officer in the call for service loop responding to calls. But we've had 40,000 calls last year alone, and we're rising, expected to be 45,000 this year. And so each team is unable to respond to all of these calls. So this funding will greatly help. Since COVID, we have seen an increase in our mental health related calls. We've had an 18% increase with an 8% increase in our suicides. And so having these clinicians at these scenes, connecting these families, not only do they help the person that's calling, but also the family members to resources that for continuity of care. It gets them into a different program instead of using the HPD call for service loop. It's a more permanent response and it's a better service to our public. CERT now handles just a fraction of them, as I noted, and this overtime will allow another 417 CERT teams out in patrol until the end of the year. And so with that, I would like to thank Mayor Turner and also Stephen Williams, the Director of Houston Health, for this program. And it will greatly enhance our innovative strategies and our response to the public for a more permanent response. It's just a better program instead of just sending an HPD officer. Now I'd like to introduce Lieutenant Julie Pleasant, and she's here to talk about the DART program.
Thank you, Chief. Good afternoon, everyone. I'm Julie Pleasant. I'm the lieutenant over the Victim Services Unit for the Houston Police Department. What DART is better known as DART, but it is the Domestic Abuse Response Team, and it's more than just an officer and an advocate responding to the call when a unit asks for assistance. As we all know, victims very commonly feel scared and alone when patrol officers leave that scene. So we bring an advocate to the scene, to that residence, to answer what will happen next. What will happen next? The DART unit advocate will do an immediate on-scene needs and safety assessment. If that victim needs immediate medical assistance and for whatever reason does not want to go to the hospital, we have a team of forensic nurses that ride with a supervisor unit. They will be able to come to the scene and provide a free domestic abuse forensic exam. And then that will follow the chain of custody so that that is able to be used in a court of law when the offender comes to court. And those forensic nurses will testify. That will put the burden less on the victim and more on the offender. The other thing it will avoid is a 2 to 3 hour wait for a domestic violence medical exam because there's only a county hospital that provides that right now. So an excellent resource. The victim is then informed how the police investigation will proceed, and they're able to be linked immediately for emergency medical services with community providers, follow-up care on funding for medical assistance, legal assistance, visa assistance, and emergency shelter or long-term housing. The DART is a collaborative approach for wraparound services with our community partners and resources, and that's real time. So you're sitting with an advocate, you're going over all the information, and we do direct referrals to the Houston Area Women's Center, Empowered Survivor, Montrose Center, Harris County Domestic Violence Coordinating Council, and The Bridge, to name just a few. Our partners for forensic exams are REMEX Medical and the Texas Nurse Forensic Examiners. They will provide all those immediate needs, food and clothing, transportation services, and assistance with legal emergency protective orders, divorces, and child custody. So it is a collaborative approach that we're very excited to extend overtime funding to enhance the program. And without these partnerships, the program could not and would not be a success. So we want to thank again Mayor Turner and Director for allowing us to have the funding to accentuate our services.
Thank you, Lieutenant. Let me call on Mina Patel Davis, who is the Mayor's Special Advisor dealing with human trafficking and domestic violence.
So thank you, everyone, for coming. You know, we're so glad to see this kind of expanded response building on the work that HPD has been doing in this arena for quite some time. And we also know that sometimes when HPD is responding, oftentimes things have reached a point of no return. So soon we'll also be making some things available to get to folks, both abusers and victims of domestic violence, before it reaches that point. And we'll have more information on that soon. Thank you so much.
Thank you. There are a number of things that are taking place as it relates to this COVID that has exacerbated many of the things that we are dealing with over and above what we're used to dealing with. Hopefully, things will be happening that will, I guess, start to bring this virus to an end, put it behind us rather than in front of us. And I think more to speak to that and to the announcement with regards to the Pfizer, the vaccine, that may be coming soon. Let me bring up Dr. Peirce, and he can speak to that and on any other matters as relates.
Thank you, Mayor. And yes, COVID is still here, and we reported more cases today and tragically another death. But there is a little bit of light on the horizon, and that is that Pfizer today announced that they had, this is their first interim report. So as research studies go, there are committees that monitor the research. And so this was their first report. And it came out showing that they're telling us that 90% of the infections amongst those who were enrolled in the trial were amongst in what we call the control arm, the people who were not vaccinated. And only 10% were amongst those who were vaccinated. And so they were saying that's showing a 90% success rate. So this is early. This is good news, but this is early. Let me point out that 90% is a very high value, much higher than I think most people had expected. But it's early, so we need to let the trial go to completion, and Pfizer has already pointed out that their trial is not complete. But this is a first interim analysis. And so this is very good news. Part of the trial that I want people to recognize is that during this trial they added additional groups. And so this is one of the trials that's actually being done on people as young as 12 years old. So that's another benefit, another plus with this trial. So a lot of hope to be held. Now, the downside is that the trial won't be done. It's not done now, and it won't be done for a little while. And then there's going to be some safety analysis. So we're talking about the efficacy of the vaccine, which appears to be very high. They did not comment on the safety. That is to come. Now, there's no reason to think they haven't had to stop this trial, like a couple of others had to be stopped. They have not had to stop this trial. So that's good news. But the safety part absolutely needs to be done. And the FDA and the Committee on Immunization Practices, which is a part of the FDA, and the CDC rather, will make the final determination on that. And so unfortunately, while this is good news, unfortunately, I think we need to keep in mind that the virus is still here. We need to continue wearing our masks. We need to do all of the things that were in the videos that were shown. We need to make it part of our routine. Let us not get distracted by this good news on the vaccine and drop our guard. If anything, as we enter into the part of the season where we're going to be gathering indoors more because it's cold, we're going to be gathering in family groups more because of the holidays, we've got schools opening. These are all things that the virus will take advantage of if we give it the opportunity. So please pay attention to what was in the video, maintain our strategies to protect ourselves and our families and our loved ones from the virus, and we will move forward at an appropriate and responsible pace along with our partners at the federal level and in the pharmaceutical industry. Thank you.
Chief Pinion, you want to come and give us a report with regards to the fire department?
Thank you, Mayor. Thank you for your leadership, certainly, and the work that the HPD has been doing in regards to domestic violence. It is encouraging news, Dr. Peirce, that Pfizer has been conducting their trials on their vaccine, and hopefully we will get one soon. Our numbers, for our firefighters in quarantine, are following the same trends as the cities overall, and we've had an uptick. Today we're at 80 firefighters in quarantine. A week ago we were at 60. So again, I want to encourage, as the mayor has been doing, for us to continue practicing the best recommendations that we have at this point, which is wearing your masks, social distancing, and proper hygiene. We've seen what's going on in West Texas. The numbers of coronavirus exposures and deaths are spiking. We want to avoid the same thing to happen here in Houston. Okay, we're moving in the right direction. We're holding what we have, but we have to continue being vigilant and being diligent in our safety approaches. That's my report. Thank you, Mayor.
So let me just say that this virus is impacting communities in so many different ways. But with respect to domestic violence, with respect to mental health issues, emotional issues, the anxiety and stress levels are very, very high. So we are doing everything we can to tamp that down. Let me also say that I received not too long ago a call of reported shooting on our streets that I know Chief Acevedo, Chief Fenner, as well as Chief Slinker are investigating right now, waiting to get more information on that. And Chief Bambridge may have some additional information. I do not know. But again, let me just say there are a lot of things that are happening on our roadways, on our streets, road rage, you name it. So let me just encourage everyone to really take advantage of all of the services that we are trying to make available to kind of calm people down and just be mindful when you're on the streets, on the roads, not to engage in any sort of arguments or anything of that nature on our streets, on our roads. So just be mindful of that. And just be very, very careful. Having said that, open to any questions on any of the topics that are before us.
Mayor, on the $6.2 million, it sounds like there's some money that's going to Hawk, some money that's going to HPD. Can you break down the funds a little bit more in terms of what's going where?
I don't have the detailed breakdown in front of me. Does someone have it? Oh.
So my understanding is there's $49,500 going to Hawk for the expansion of their current hotline, so what they already have in place. There's $1 million that we're going to be using for an initiative that we'll announce more information on, later, the ones that I mentioned, and then I don't know if there's a further detail from HPD.
The CERT teams that will be receiving almost $400,000 until the end of the year, and the total funding for our DART program is $5 million? $5 million.
And then, Chief, I think maybe you're the best one to address this one as well. So it sounds like you guys aren't hiring new teams. You're paying the current teams overtime to work more shifts. Is that,
Correct.
do I understand that correctly?
Yes, sir, because they're the best ones to put out there with the experience and the training. They both de-escalate, and those are clinicians already hired and work with us now in our CERT program.
And I think the DART teams work mostly on weekend nights. Is that right? Will they be expanding, or will they just be?
Yes, they did expand from just Friday, Saturday, and Sunday to now Wednesday through Monday.
Okay, and so the bulk of the money seems like it's paying
Yes,
for
sir, and that
right?
followed the stats. So
Okay.
that's what drove our decision.
Okay. And then I think there's an issue of psych bed shortages for the CERT teams. I wasn't sure if maybe you could address that. It sounds like oftentimes the CERT teams respond, but then there's not enough room in the psych beds to drop them off there.
The beauty of CERT is that the HPD officer, by law, can handle the emergency detention order. This is a mental health crisis where the clinician cannot. So the HPD officers involved with that, our first choice is NPC, ran by our Mental Health Authority. And then, yes, because of lack of bed space, they're often on diversion, and so then we go to area emergency rooms. Last year, we had 12,000 emergency detention orders, HPD alone.
And Chief, did you have any update on that shooting that the mayor mentioned? Or?
I would like to say, and thank you for asking, the chief is at the scene, and he will be given the sound bites from there.
Okay, thank you.
Thank you.
And let me just say, and the goal is, even once we get past this year, to be able to find additional funding to keep our DART teams as well as our CERT teams going. And so that's the goal, is that even once we get out of 2020, we certainly want to keep the DART teams and the CERT team going at an expanded reach, to expand their capacity, and so we'll have to look for additional funding on that. But what we do know in the midst of this coronavirus is that the number of calls have substantially increased.
My question to the chief, you keep talking about the Women's Center, domestic abuse and violence, as if domestic abuse is just a women's issue. I think we are dealing with gender equality and equity issues here. And I would first start by asking you, is there any data that shows that women are also involved in abusing men?
Oh, yes.
How have you treated that over the years or the months? and what is the statistics? And I would have loved to follow up, but it seems like you got an answer already. So I'll listen to that. Thank you.
Yes, sir. So we do have quite a bit of women who abuse men as well. The statistics are proven probably a third higher, women to men, men to women. But no doubt, there is a large proportion of men that are also abused. However, most of the time, our men do not outcry. So we will get called by a neighbor. We will find that he has been abused, but he will not want assistance or resources because there's a shame factor in there that he's been abused by a female. So I'm in no way saying that men are not abused at all. It's a fact they are. We go to the scenes every night, but they do outcry far less. So that's what we know. Thank you.
Question for Dr. Purse. Once the vaccine is available, can you describe how it will be distributed to the city of Houston?
Yeah, really good question. So depending on the manufacturer, there's a couple of different ways that it may get distributed at the national level. The federal government has set up a pathway for it to be done through the Department of Defense, and then some of the manufacturers themselves have a way of distributing vaccine across the nation within their own existing ways. Because remember, some of them have been making vaccine and distributing across the nation for decades. And so depending which manufacturer comes out will probably determine which way it's distributed to the communities. Now within the communities, again, you have your usual avenues of vaccine distribution that have been in place for decades. Those will be capitalized on. But then in addition, because we're going to be looking to vaccinate a much larger portion of the population, the local health departments, including the Houston Health Department, are working to establish more vaccine providers than we would normally have. So we're building those relationships, getting those agreements in place now, and anticipation. So it'll be a big effort. But the plans are in place and they're coming together. But to specifically answer your question, we need to know which vaccine is the one that's going to be distributed first.
Mayor, I know we're getting the information on this most recent shooting
Yes.
out on the scene from Chief Acevedo, but there were 6 shootings today, including this latest one. I was wondering if you just wanted to say anything about that.
Yeah, and what we've noticed, and that's one of the reasons for this press conference today, is that a great deal of stress, anxiety out there in our community. People are suffering from emotional and mental illnesses, a lot of domestic violence. There are just a lot of elements that have been compounded or caused by the effects of the coronavirus. People have lost their jobs. People are staying home more so than in the past. There are a lot of different factors that are in place. People are concerned about the ability to pay their bills. And when you combine these healthcare issues with these economic issues, with the relational issues, all on top of one another, layered on top of one another, there are a lot of people who are just on edge. And then when you factor in a lot of guns everywhere, there are just a lot of guns everywhere. And I'm not saying people in many cases don't have the right to have them, but when you put all of these other elements in play, and if you're in the wrong place, wrong time, the wrong conditions, then it can be quite combustible very, very quickly. And things that may start off okay can quickly ramp up. And so we're doing what we can to address these areas: domestic violence, mental health, emotional issues, providing more clinicians out there to be able to make services, healthcare services available. Next week, you'll hear more about a mental health hotline even being expanded. So there are a number of channels that we are putting out there to encourage people to utilize them, to talk with counselors, just to make things available. So we are just trying to approach things on different levels. I've talked, for example, last week, I had a meeting with a number of what I call community activists, soliciting their help and their input on utilizing their channels to reach different audiences that may not be tuned in, for example, to these type of press conferences. So we are working with them and trying to design some initiatives with these more community activists that can even get further into various communities and neighborhoods. So we're going to be looking at all different modes of trying to outreach and reach people to kind of help them through these very uncertain times.
And this question may be better for one of the HPD representatives. Sure. Out in the field, when you're heading out to a domestic call, what in general is different during the pandemic? Are things more volatile, or what are your officers seeing?
So I would say the domestic call itself starts out the same, you're dispatched, but the level of crime, as the mayor spoke, he said some statistics of how they, at first they were up and down and up. Well, they've leveled off now, but the violence of those leveled off calls is higher. So we are reporting to get statements from victims more from hospital rooms than we are on scene. For instance, for all of 2019, we had 281 strangulation cases for the entire year. Right now, as of October 15th for 2020, we've had 416 strangulation cases. The only difference between a strangulation case and a homicide is about 60 seconds. That's it. So that's what we're seeing more of. We're seeing more violence than we had ever before, Thank
you.
My question to the mayor. Mayor Turner, there are people who are making a lot of noise out there. We have a lot of Republicans in the city also, and they are very particular about the CARE dollars. Many say that the time frame or time limit for the money that was allocated for Houston to be spent is December. So with all of this talk, is there a lot of that money that the city doesn't have programming to spend, for which we should call the community to initiate programs which the city can partner with and sponsor? And if that be so, how much percentage of that which was allocated is available? So that we don't have money which the federal government will come back and claim that they want because we did not exhaust it.
Well, what I can say to you is that we are on track with exhausting the entire $404 million that the city was allocated. There's no question about that. And we've partnered with a number of organizations outside of the city of Houston, whether it's in terms of the small business economic relief packages, whether or not it's the rental assistance programs, whether or not it's working now with domestic abuse, a number of outside partners that we have, that we are working with. Quite frankly, even more assistance is needed on the local level. And all of these initiatives that we are working with are where dollars were not appropriated, for example, within our budget. This is outside of any appropriated dollars. But as we have been saying today, COVID-19 is an insidious disease, and it impacts people on multiple levels. You may not necessarily have been contracted the virus, but for whatever reasons, you may have been laid off, okay? Or just the separation. We tell people to social distance, well, that is antithesis of human behavior, and sometimes that creates negative side effects. People are dealing with so many other elements that we may not even have a clue of what a person may be experiencing in his or her life. But it is being reflected in people's behavior, and we're having to deal with that. People are much more on edge, okay? The road rages have increased exponentially. So not only are we dealing with what's happening with the dynamics in people's homes or in their apartments, we're dealing with their dynamics on the streets of the city of Houston or wherever they may find themselves outside of their homes. And so for today's conference, the focus is on mental behavioral health issues, crisis intervention, how to come down a domestic violence situation, providing more assistance for clinicians, because these are the things that we are finding on our streets. And everyone is impacted, from classified to municipal employees to people who are in the private and nonprofit sector. Okay? But all of the $404 million that have been allocated, appropriated to the city of Houston, will be exhausted this year. We're on track to do that. And we're trying to meet the needs of people in many, many different areas. Okay? We'll have more details with respect to the shooting, I'm sure, and a little bit later on, but Chief Acevedo, Chief Slinker, and Chief Enner are on the scene. I'm sorry, one.
Sorry, Mayor, I have a last-minute question from
Sure.
KPRC. Firefighters say the city has reverted to staffing fire trucks with 3 firefighters instead of 4. Why and how long will this remain?
Well, I'm going to bring up Chief Fenner, but let me just say this. We're dealing with so much. I'm not going to keep playing games with people who are trying to score points during this virus. We're not going to do that, okay? And I think all of you are aware of the games that are being played there. Chief.
Thank you, Mayor. I want to piggyback on what the mayor says. Look, this is just a continuous campaign of misinformation just to create chaos. The city and this administration, fire administration, has been clear as far as our attempt to maintain full staffing, but we are dealing with a significant number of personnel out on quarantine. We're dealing with a significant number of staffing that has come down as a result of the decisions that were made in the past with Proposition B primarily. So we're managing the consequences of that. I can tell you that our focus is to ensure that all units that are in service are fully staffed and operational. Our priority is to give priority to the ambulances and to the fire engines and to have every fire station staffed. If last week we had to deal with the issue of shortage of staffing, we had 60 firefighters in quarantine last week, and we had another 80 that were off sick or on other unscheduled sick leave. So when we have that many people out, it makes it more difficult to staff every apparatus. But our focus is to ensure that we're providing safety for this community and providing safety for our firefighters.
All right, we're all dealing with COVID-19. Let's not try to score points just for the sake of scoring points. Let me leave it like that. But I've become so numb to those type of attacks. Okay? Okay, thank you all so very much.